what is that age where you said you miss?
See, it is very tricky. If you look at it, technically if you look at the IVF results, a treatment as advanced as an IVF, the best result in the best patient I said is around 40 to 50%. That means best patient when I am talking about a female age of less than 32 years.
So does that age reduce the quality of your, it does, right?
Yeah.
It does.
See, if you look at it, I think the age is probably the most important predictor for your pregnancy. Like I said, this is a question, or this is something that I tell in a lot of my interviews, is like a lot of people ask you like what is an ideal age for marriage? Like that's a question that a lot of people
ask you that?
Yeah, you know, it's like that's something that we always end up. See, I think there is no ideal age for marriage. You can actually fall in love with anybody that you want at whichever age you have, and you can get married. But what or where the age is important is probably to have a child. So if you technically look at it, when God created women and things like that, if you look at it, the older times, the most fertile period around, say it's between say 20 to 25 years is the most fertile period. And after that, what happens is that it's not that the egg quality reduces, but then females will end up starting to have some kind of additional problems like fibroids, endometriosis, all those diseases, female reproductive organ diseases will start coming when they are like 25, 26 years, and it keep on increasing. So it becomes more and more difficult for them to get pregnant.
The chances are.
Now the egg quality, they say the best egg quality is somewhere around 30, up to 30, 32 years. So if you look at an IVF, like I said, when I said the best result in the best patient is around 40 to 50%, is for a patient who is like say less than 30, 32 years. After that, I'm looking at if everything else is normal, purely on the age, if you look at the fall in success rate. See, by 30, like I said, 32, it's 40 to 50. By around 36, it is around say 35 to 40. If the patient reaches around 40, then the fall is steep. When the patient is around 40, your results are less than 20%, even with an IVF. The patient is above 42, it's less than 10%. And if the patient is older than 45, they say it's almost less than 5% or 3% or something. It's extremely low.
You do treat someone who's at 45?
Yeah.
Oh,
see, whenever we do a treatment, so like I said, it's very important that you counsel them. We tell them this is the results that you should expect when you're doing this treatment. I cannot tell them that I'll give them 50% result and do a treatment for them. I should always tell them this is that you should expect. Understand this, because there are people who want, like say, if I tell them that you get 40% result, no. Unless it's 100%, I will not do a treatment. But there are people who tell me that even if I'm giving them 1%, 5%, they say, no, I would like to try it once. I would like to give that attempt. But then it is something that we mutually sit down, discuss, and then they decide on the treatment.
Go for it. So, if she is around 45, what would really help is if she did an egg freezing at a young age. She could have that quality egg easily put into her, right?
Yes, see, the whole idea is that the freezing, that's why I said freezing the eggs when they're younger is more ideal. Like say, I would say less than 35 is probably the ideal. So that even if they come back later or they get married later, they find a partner later and they decide to have a child, we can always use I said the most important factor of like say a pregnancy. Actually, if you look at it, women are the most important people as far as for a birth giving. Sperm is only a transfer of the genetic material of a man into the uterus, but it's the egg which receives this thing, and it's the egg that becomes a baby. So that is why females are so important. Any small problem with a female always affects the results, whereas men, even if you have very less sperms also, your results are not that bad. At the same time, females, as the age increases, some problems increase, the results will keep coming down. So if you are able to freeze these eggs earlier and then later on, we are again using the eggs which were younger. So our results are of a younger egg. Our results are as good as when we would have done a treatment at that point of time. So that is the whole idea of social freezing, that you are able to freeze the egg at a time where you have good quality eggs, so that we can utilize it at a time when you don't have good quality eggs to utilize.
Yeah, so important. I wish someone told me about this, when I was younger. It would have made the process a lot more easier. I don't think that many people have got the knowledge about Is that something that you see the trend is changing? Are people more acceptable
I think
towards
that
egg freezing right now?
Yeah, definitely at this point of time, I think people are more aware of it. People do come and ask, but like I said, not to the level of what my friends or colleagues say that
Yeah, I
what
know.
happens in
Okay.
the metros. But yes, we end up having a lot of people. So we always sit down and talk to them, see what are the benefits, because a lot of people don't know about it. They want to actually come and sit down and discuss actually what are their benefits of, like
Yes.
I said, when 34-year-old came, I said yes, let's do it, and we have frozen. We have some, I think some 5 to 10 patients who are already frozen and kept. But there are younger patients who come. I'll always give them that option. Yes, do you want to do it right away, or else you want to wait for a partner? If you realize that by 32 you don't, by 30, I'll do all those tests. There are
Yes.
certain tests which tells me how is the egg quality and things like that. If all those reports are normal, I'll always take some more time, see if you are able to find somebody, if you're sure that, if it's like that, if things are okay, then I'll wait, or else you come back after a couple of years, I'll do the egg freezing.
Okay.
See, for me, I can always do it anytime. It's not about, but I obviously what we have to do, what is best for them. I don't have to do a treatment just for the sake of doing the treatment. That is the whole idea. No? Whenever we are offering a treatment, like I said, the first thing, whenever we are doing a treatment, the patient should be very clear why I am doing that treatment or why that treatment is ideal for her. So we should very clearly tell them that this is why I want to do a treatment for you. This is the right age for you to do a egg freezing. Let's do it. If this is not the right age, let's wait for some more time. See if things work out in your family. If you are able to find a partner, if things are not working out, yes, come back to us. We can always do it.
Yes.
There's no, you're not going to like lose out on.
Yes. Is the process once they have frozen their eggs and they're coming back, to get that whole pregnancy routine, the whole journey, starting with the whole journey, is the process same as IVF? The same injections?
No, but then you don't need those
You
injections.
don't need those.
See,
No, I'm not talking about that. I'm talking about to maintain.
Yeah, the maintain obviously yes, because probably that post transfer again it will be a controlled cycle. See, now the body does not have made the eggs. What happens naturally is that the body will make its own egg, it ruptures, and that area which made the egg produces hormones to support the pregnancy. That is what naturally happens. So in an IVF or any kind of controlled treatment cycles, the body does not know what is actually happening. So we are supposed to give it medication for it to get supported. So probably you pick stimulation and egg pickup and all will not be needed for those group of patients. All that they'll be needed is once the uterus is ready, we take the sperm, we take the egg, remove it, take it out of the freezer, like we call it as thawing the egg. We thaw it, then we get an egg, we fuse the sperm, grow it for 2 or 3 days or 5 days depending on the patient, and we transfer this embryo and we have remaining so the second part is there, but then you don't have to go through that first part.
First part, but the injections and everything.
Yeah, supportive
else,
injections probably might
because
be
of
there.
the age, or
not really because of the age, because of I think, like I said, now we are to a certain extent. I think we are like bound by habit that we know that these things support has to be there.
Okay.
And we are little worried that if it is not there, like I said earlier, a lot of times when we are giving support for these medication for these pregnancies, we, like I said, we sometimes little overdo it because we don't know if we are underdo it and if it does not work. Now in this situation, egg freezing, if it fails, and then realize again, and if I don't have again eggs to do another cycle, if that is only eggs that I have, I would like to go all in and out to make sure that this somehow get pregnant. So I give all the support to that patient. So it primarily depends on, we don't see any other major issues, then basic supportive medications, so you don't really need injections. See, there are injectables, there are gels, there are tablets, there are several forms of supportive medications. But what we always feel is when we are actually giving these support medications, we always make sure that depending if it's a young patient, things are all okay, we might give a little lighter supportive medications. At the same time, when multiple failures and all those things, we make sure that we give them a stronger supportive medication, because I think that is a liberty that we take depending on the patient profile to give them what they want. Now there will be patients who you could have given a stronger medication.
Yes.
If it fails, if it's a good patient, we give them simple medications, and later on they fail, they say, no, you could have given us. That question always will come.
Absolutely.
But then I think that we don't have answers for all that, but we have to take it step by step.
And the cost also differs, right? It would be a little lesser than what, because with the IVF you're considering the first half
Correct. So means
So-
it's only the later half that is going to get charged. So
Charged.
basically, you are literally splitting the whole.
So it could come to approx about 1 lakh or something?
Probably
Or-
after
yeah.
that. Yes. Yes.
Yeah.